Okay, welcome and good afternoon, everyone, to our session. How is the sound in the back? Good? Okay, you let me know if I need to get a little bit louder. The guy said this mic is gonna pick me up, and I'm gonna try to stay close to the microphone so that everyone can hear me. And if you have a question, I'm gonna repeat it into the microphone so everyone can hear your question. And I appreciate you to ask questions throughout our talk so that I can address any of your comments or questions throughout our talk today. So I just wanted to say good afternoon and welcome to our session. I'm very pleased to lead a discussion on a topic that I'm really passionate about, helping children with complex communication needs. My name's Emily Quinn, and I'm a speech-language pathologist. I'm also a doctoral student at Vanderbilt University. And prior to coming back to graduate school, I worked primarily with children who required AAC, children who had complex communication needs. Now, that's a term that I'm going to be talking about a lot in our talk, and what I mean by that is children that cannot use their natural speech to meet all of their daily communication needs. And so that's sort of this term that some of you might be familiar with, but in case that you're not, that's what I'm referring to when I'm talking about individuals with complex communication needs. I also want to thank my colleague Alexandria Cook for being here this afternoon. I wanted to say, here's some contact information about us. If you have any questions about anything that we cover, you can email each of us. If you have questions about the website, we're going to be sharing some information that's accessible on our website. You can email us there at info@communicationmatrix.org. I also wanted to say that this project is supported by grants from the U.S. Department of Education. We don't have any relevant non-financial relationships, but I did want to take this time to express a sincere thanks to all of the people who have participated in the Communication Matrix team, parents, educators, speech-language pathologists, and part of the leadership team, anyone who's really been involved in this project that we're going to talk about today. We are going to start. I'm going to give you a brief overview of where we're going today. Today, I'm first going to highlight some standout platforms on social media. And I'm going to talk about how they support speech-language interventions. We're going to talk a little bit about the benefits and drawbacks of different aspects of social media and how we use that to support our practice. Then I'm going to describe to you what a community of practice is and give you some examples of how communities of practice can help you in your interventions for students or individuals with complex communication needs. Then we're going to launch into the part where we're going to demonstrate and introduce features of the Communication Matrix community. How many people in the room are familiar with the Communication Matrix online assessment? So a good portion of people are. Many of you may or may not be aware of the fact that we've launched into a new part of our website, which is a community of practice. And so we're going to talk about that today. And we're going to share some insights from the beginning of our study implementation that looks at how practitioners, how educators, how parents, how professionals are using our community of practice to support students in different school districts across the country. So let's launch into talking about social media. Social media has started to play an increasingly important role in supporting speech language pathologists and educators in developing educational programs for children, all children, whether or not they have significant disabilities. As you are well aware, there are many different platforms that can support our therapy programs in different ways. For example, we have blogs. Many of you might be following blogs, or does anyone here have their own blog? No? Okay. Some of my favorites related to speech-language pathology are Practical AAC and Speech Room News. And so blogs are great because we can go there and find information, some new suggestions about therapy techniques in a very accessible format. So blogs are really great for that. We may grab ideas from across the internet and start to organize them into our own Pinterest boards. How many people have a Pinterest board that they use for therapy? So quite a few. And so that can be really great for cataloging some ideas that we see across the internet. As well as we might communicate with our friends, colleagues, possibly students and parents using Facebook. We might follow some of our witty SLP peeps on Twitter if you're a Twitter user. And we might share musings about therapy or recommendations or let people know that we're attending events in our community. And so these are all really valuable aspects of technology that can help support interventions, as well as Instagram. Some folks might follow SLPs on Instagram who are posting images of some of their therapy materials, and you might scroll through a platform like that, an application, to find new ideas for therapy and comment on some interesting ways that you might use similar materials by connecting with other SLPs online, and so, or educators online. And so social media is a really powerful tool, and it has enhanced our lives as therapists, no doubt. And it may have frustrated some of us to a certain degree as well, to try to keep on top of all of the things in social media. So thinking about how social media can help us as interventionists, there are several benefits, some of which I alluded to before. So things that I really like about social media is that it really showcases the creativity of speech-language pathologists practicing. Most websites and things that you find on social media are freely accessible. You don't have to pay to have access to a lot of this information. It's constantly being updated, so you can constantly find new ideas about how to best support students. It promotes a lot of resource sharing, which I think is a wonderful thing that's been happening since people are getting more involved on communities online, where we can share treatment ideas for speech-language therapy. And one of the things that I think is the most important about social media is that it can facilitate interprofessional education and collaboration. So SLPs having a presence online allows our reach to go far beyond our clinics or our classrooms. We can connect with parents, with other educators, with occupational therapists, with physical therapists online, sharing our ideas and letting people know and be advocates for students that require speech and communication services. And so I think that's one of the most powerful things about social media. But there are some drawbacks. So some groups, like on Facebook or other blogs, might be closed. So they might be insular communities where only participants are a certain member. So you might be involved with a group online where it's an SLP's only discussion board. Or another drawback to social media is that sometimes it limits more two-way conversations. It's more of reading and disseminating information. It's not really about a back and forth about how I might use this information for this particular kiddo or student. And I think the most significant challenge about social media as it relates to this topic is that a lot of it really lacks information about children with complex communication needs. There are some really good resources out there that you can go to, again, to find information, but it's not necessarily building a community around supporting professionals that are working with children and students. Now, I work with children, so I'm going to keep saying children, but you can acknowledge that this will work for adolescents and older adults as well. So I apologize for that, but I'm going to slip into that because I'm an early childhood person. But I think that's the most significant problem or issue that comes up in social media, as well as just understanding the accuracy of the information. I think that is a challenge. Many of you in the room may be AAC or experts with working with children with complex communication needs. However, the majority of SLPs do not feel that way. Very few SLPs feel like they're experts in the area of AAC, augmentative and alternative communication. Now, we know that that on from a number of different ways. So for example, when SLPs are surveyed, almost 80% of them feel like they do not have the expertise to serve struggling learners who use AAC. And about 33% of those individuals surveyed said that their colleagues didn't have the necessary knowledge. And that colleague, again, goes back to that idea of that interprofessional practice. So they may be talking about their SLP colleagues, and they may also be talking about their teachers and other paraprofessionals in the school district, that they do not have the knowledge to support learners. When you look at teachers' responses specifically, in some information from some qualitative research, we find that they report having very minimal opportunities for training, to attend communication trainings, to problem solve with other teachers, as well as to receive any sort of supervision or mentoring to develop stronger IEP goals. And so that's really problematic. And one way that our research team that's associated with the communication matrix sought to address this lack of expertise was we started to add things to our website and then test the effectiveness of those additions. So we created a webinar that helped people, teachers and SLPs, walk through how to conduct a communication matrix assessment, and then provided a scaffold for developing a clinical report, and provided recommendations for intervention procedures and goals to practice. And what we found from this study that looked at the effectiveness of just these 3 additions, we saw that the quality of IEP goals were significantly better for the group that received this extra support in completing the communication matrix with the webinar and the support with the custom report. We also saw that the proportion of IEP goals that were achieved was significantly greater for the experimental group. So teachers and SLPs who participated in this study learned a lot from these tools that we added to our site, but we still felt like that wasn't necessarily enough. And we wanted to continue to enhance speech language pathologists and teachers gaining experience and expertise working with children with complex communication needs. So we started to think to ourselves, is there a way that we could spread our ideas through social networks? Is there a way that we could build a community online to ask and answer questions? And can we expand our current research, because the kind of information that we were getting from people who are users of the communication matrix was, well, I did this assessment and I love this assessment, but I'm really not sure what to do next. Or, I love this assessment, I use this assessment, I've been trying so hard to get people in my school to use this. And so we really felt like we needed to develop a community around this tool that has been so revolutionary for speech language pathologists and educators, and supporting the students that they see in their classrooms that have the most significant needs. Now, for those of you who aren't familiar with the communication matrix, it's an online assessment for early communicators, so communicators who developmentally their skills are between the ages of 0 and 2, and it goes from pre-intentional communication all the way up to the language level. And if you have questions about the communication matrix, I can address those after the talk, and if you want me to show you more information about the assessment in particular, we certainly can do that. So we're going to talk now about, I'm throwing around this term, this community of practice, and I wanted to take a little bit of time to describe what it is that I actually mean by that, because it's sort of a very theoretical or nebulous idea, right? So a community of practice is a place, it's a community that leverages the knowledge of a widely dispersed set of stakeholders, widely dispersed members across professional boundaries, so across disciplines, to share information and to address problems. A community of practice is a model for professional development that focuses on implementation. So it focuses on doing, it focuses on therapy, it focuses on educational planning, and it supports professional development through this iterative process, through this back and forth process of learning something, doing, and then coming back and refining what you've learned. And it's a model that facilitates learning through collaboration across these different stakeholders. So I think especially for supporting learners who use AAC, it's a wonderful model of professional development because there are so many people that are involved in those students' planning. And you may already be a part of a community of practice in your job or online through mailing lists, social media, or forums. And again, our purpose is to spread ideas using communities of practice. So it's really expanding continuing education beyond conferences. Now, we're all here at ASHA, and ASHA is a fantastic convention. However, I'm sure you could count on your hands how many people that you know that are unable to attend for a variety of reasons, because they can't afford the registration, because they have young children and they can't travel with them, because their school doesn't support professional education in the way that your setting does. And so it's important to continue professional education in avenues outside of conferences, as well as moving beyond this idea of training and failing models. What that's referring to is the idea of an educational consultant coming into your district, giving you a one-day training, and then no ongoing support. Because from what we know about studying professional education and how evidence-based practices are implemented, this is not a very successful way to get EBPs widely used in your setting. And so again, the other interesting part about communities of practice is they can focus on the goodness of fit of specific interventions to your school or your clinic. So in some settings, I'll give you an example. So you might be working with a teacher and you're recommending that the child use their AAC system to participate in a shared reading activity with small groups. And the teacher's like, that's really going to change way too much of what I'm already doing. I'm not really sure that's going to work. And you think, well, I know that shared reading for children who require AAC is a really important practice. We're demonstrating a lot of evidence in this area, but you don't really have a lot of suggestions on how to actually make that practice fit for your school. And so that's the kind of conversation that you can have in a community of practice. And you say, I know this is a practice that has empirical support. I know this is practice in research, but I just don't know how to make it work in this teacher's classroom. So that's kind of what I mean about the goodness of fit of specific things. So again, we can harness social media to help see how these ideas spread through improving educational practices for individuals with complex communication needs. We can deepen our knowledge and expertise in it. Assessment and intervention for individuals with complex communication needs. And it's another way to provide a timely and relevant solution. So you don't have to wait months to get an answer from an expert or an educational consultant from your district about how to help these students. You can help them right away by using your network to answer those questions. So crowdsourcing knowledge. And again, we can use them to discuss the contextual fit of assessments and interventions in your school or clinical setting. And overall, we're trying to ask ourselves in developing such a model, how can we support professionals right now? And so just to help you understand what this is, I'm just going to go through a couple of examples of communities of practice that you might already be a part of. So how many of you folks participate in the ASHA communities online? So quite a few of us. That's great. And the ASHA communities are fantastic ways. You get a digest of information. You can ask and answer questions. However, the downfall of that is that it's only open to ASHA members. So it's not something that's readily open and available to lots of different community members. And so that challenges us in supporting interprofessional practice when many of our team members don't have access to the same amount of information that we do. So other communities of practice you might be a part of are the National Center on Deaf Blindness. If those of you work with children that are deaf-blind, you might have participated in this community of practice that they have. And the Mighty is a great website and blog that families are orienting around about how to care and how to support and how to advocate for their children with disabilities. And some of you might be a part of professional learning communities in your region, or you might be a part of that in your school. And so you can think about a community of practice like a professional learning community as well, if that's something that your school has been a part of. Any questions at this point about some things that I've talked about? Comments? Okay, no one has any, so I'm just going to keep going. So some of the advantages to communities of practice is that they can be accessed in rural areas. How many folks are from rural areas? And I'm sure that you know that your reach as an interventionist is quite far, and you probably are lacking support compared to some of your peers who might be in more urban or suburban areas. And so communities of practice are great if you live in rural areas, because it can connect you to experts that you might otherwise not have face-to-face time with. So that's a really great thing. Time zones aren't an issue. You can access information whenever it's convenient for you. And again, it encourages sharing across these geographical boundaries and also across interdisciplinary boundaries, if you want to think about that as sort of a geographical boundary. And I mentioned this before, we're crowdsourcing resources and expertise in these communities of practice. And it's especially important for low incidence populations where you may be one of the few therapists who have ever worked in your district with a child with Dandy-Walker syndrome. So you can connect on a community of practice around addressing needs of very specific populations and find other therapists who have worked with students like that, or connect parents to information about communication that often doesn't exist for individuals with rare disorders. However, there are some disadvantages. It does take some time, like any sort of changing your behavior, changing your practice. You do need to have internet access, although that's something that is becoming less of a barrier to people. Well, you don't need to have internet access to be a member of a community of practice, but for our community of practice that I'm going to show you, you do have to have internet access. However, we have optimized our site so that it's accessible on mobile platforms, because we know that some families in low resource communities might not have internet access via their homes, or traditional computers, but they do on cell phones. So we've tried to accommodate them and make it easier for them to access this information. You do need to have some technology literacy. We'll talk a little bit, and you might be very sophisticated technologically, but as we start to go through the site, there might be some things that are confusing because it just requires some practice and some understanding of how the websites are set up. And so I think depending on how comfortable you are with technology, that could be a barrier to you. And the other thing is it's sort of this nebulous, unclear responsibility. So what's my responsibility to a community of practice? Should I be an active member sharing my lesson plans and posting and sharing information to different websites? Or am I someone that's just going to go and read information and sort of think about that and implement that to my practice? And so because of that, people might take them a while to feel comfortable and confident in being a full member that's commenting and posting and sharing on sites. And so we'll take a little bit of time now to take a look at pieces of our community and take a look at who is using our community of practice. So one of our biggest users are speech-language pathologists. And so this is us hyperlinking to our community, and what you can see is this is a post by 2 speech-language pathologists. They have a description about what their post is, and then you can see that these are practical suggestions about this topic, which is language domains and why we need each one in AAC. And so that's arguing that we need to not just focus on maybe functional communication, but we need to be addressing all these different areas of language. And so you can see that, just going to make this a little bit bigger. You might have to zoom out. Show me how to do that. Okay, there we go. Yeah, I just wanted to make sure that you could see on the side here. So you can post that to Facebook or Twitter if you really like this post. So again, we can continue to be connecting with wider social networks that you're a part of. And down here you can see that this is part of a collection, and Alex is going to talk to you about collections. So SLPs are posting information that they think is going to be useful to this wide member, these different community members. So other people that are using are parents and family. And that is really critical to us, to be able to have parents have a place where they can get really great information about how to support their children. And so this parent, Sandy's posting about conversation boxes. So I'm not sure if you're familiar with that idea. I'll show you a picture. So this is her son, and they're describing a trip that she went to a harvest festival or to a farm, a fall festival. And so she shows pictures, and then she shows down here this conversational box that she has. And so she has these little remnants to help her son tell the story of the occasion where they went to the fall festival. And so this is going to help him remember and at least share this experience with other people. And then Sandy sort of talked about what she did with her family that day and how supporting her son's communication in that way is allowing him to talk about his experiences in the corn pit and his experiences going to the fall festival. So not only are speech pathologists sharing information about that are great intervention strategies, but parents are too. And that is very important because parents are a member of our interdisciplinary teams, and they sometimes don't have the voice and they don't get to showcase how they're experts in their child's communication, but this community is going to give them the power to do that. So again, we've got some other professional members. We have a occupational therapist here that's posting about taking the first steps towards literacy. So we've got parents, we've got SLPs, and here again you can see that you can post out to wider social networks. You can see that this post has been viewed a lot of different times, and some people have liked it. And you can see here that we have these hashtags, so you can sort of search within our community and you can suggest hashtags so people can find information that's relevant to them as well. So those are another example of members of our community. And then another very large group in our community are teachers and educators. And so this is an example, and you can see here that you can post videos to this, and this post is from an educator talking about another educator's feelings about professional education and training, and this happens to be about her experience learning about the communication matrix. But you can see that it's a platform that you can share videos with other therapists, examples, tutorials maybe that you found online of different programming, different software programs for children that use AAC, and again, just sharing these resources. And then some faculty and pre-service students. So is anyone in the audience a faculty member that teaches in a university setting? No, but if you were, you could encourage students to be able to learn about practices through participating in this community. And so now I'm just going to transfer the talk over to Alex. She's going to talk a lot about the central features, some of which I've alluded to that she's going to talk about in more detail. I'd be happy to pause for questions at this time and just see if anyone has anything that's on their mind based on this beginning part about this is a community. The community is to support intervention and educational planning, and it uses a variety of knowledge across disciplines to help do that. So that's that main point in the beginning here, but who has questions about anything? No? Okay, we'll press on then. I'm sure you will after Alex is showing you some of the community features.
So I'm Alex Cook, and my background is in psychology, and now I'm a research assistant at Oregon Health and Science University. And I have a background song for my introduction here. So I thought that was actually coming. No. So I am going to go through the central features of the communication matrix community, which is, as Emily described, an online community of support for professionals and family members of individuals with complex communication needs. And the big point of this is all these disparate professionals and communities that Emily was just talking about come together, all for the shared goal of improved intervention for individuals with complex communication needs. So I'm going to show you the community through the lens of the audiences that she was talking about. The community is both free and open to all. It was really important for us to keep the community free and open so that parents and professionals could discuss strategies in the most welcoming environment. We don't want to shut anyone out or anything like that. We want to have a lot of cross conversation. Users can add posts in any language. The guts of it are translated into 7 different languages, including Spanish, traditional Chinese, and others. Those are our biggest languages, though. Okay. So, first we're going to look at the forum where you can write posts. We were just looking at some of that with Emily. So one of the things you can do is ask for help. It really offers users a platform for discussion and sharing of resources, asking questions, and sharing successes. You can also publish events that you're a part of, which is a really great way to find new events too. I'm not really going to show you that part of it because we're going to focus on the forum and the other sections I'll show you later. So you can ask for help, offer suggestions, upload PDF, video, lesson plans, data sheets, and more. So we're going to look at this example of a parent asking for help, and she's asking about getting a reading specialist for her nonverbal daughter. And she's explaining that she, has gotten seen some resistance for this, and a lot of the people she's working with don't think she needs a reading specialist. And so she's asking, are there reading programs out there for my nonverbal child? And you can see, we have a number of replies. That's another thing that you can do, very in-depth things with links and suggestions about where to go from there. One more thing I wanted to show you with this as well. With the tags, they function like hashtags on Twitter or Facebook. So they really get you to organize the data. And one thing we do is we have the please help tag. So if you, I'm sure many of you know a lot about AAC and communication interventions. So you could go through this and help someone out for, in minutes, and people really appreciate it. So if you have a lot of knowledge, that's one way you could contribute to the community as well. So you can also comment on ideas and share your experiences. So why don't we look at another parent here talks about their journey toward cochlear implants. And they were hesitant about it at first, and they decided to go for it. And as a professional, you could, it really gives you an idea of what is in the minds of your parents. In this example, considering cochlear implants. So you could both share it with parents who are considering this, and you can also gain insight to the numerous decisions and pros and cons that go into parents' heads. An important part about creating this community of this kind is to make it easy to search for what people need, because a big part of it is the just-in-time learning. This is what I want right now. This is how I'm working with my kids. So you could search for cochlear implants and find that article that or post that we just looked at. You could also search for shared reading. Maybe you want to start doing shared reading in your classroom. And we can see a number of people have, linked to other sites that provide shared reading, and SLPs and professionals have also shared their own shared reading. Here's shared reading for Cat in the Hat, and you can click the PDF and see their whole shared reading that they created and every step that they use to share this shared reading with you, and you could use that in your classroom, today. And I'll show you how I got there too, if we can. So there's a search bar at the top of each page, and then you just type in shared reading. And then that'll get you this page with a number of posts on whatever you want to look at. Okay, so the next thing I want to show you as well is I was talking about the many languages, and here is where you can switch it to a different language. So if we go into another shared reading post, it's not going to translate the text itself, but it will translate all the buttons and everything like that, and you can respond in Spanish if you want to. And the post interface will be in Spanish or whatever language that you choose. Okay. So I'm going to go on to collections. And collections are where we have experts and parents come and post, create a collection that contains posts centered around a theme or a topic. And these can be posts that other people have created, or they can be posts that the person who is creating the collection has made. So you'll see we have a library of a lot of different ones right now. We have different ones every 2 weeks or a week, depending on how long people wanted to do a collection. So we have topics such as behavioral supports for beginning communicators, which fellow ASHA, now it's still in Spanish, fellow ASHA speaker, Dr. Zingari, created this one, and she has a number of posts that she made in here. So we can gain more expertise from her. There's another one that's special educator created that is about using peers as communication partners. And hers, you'll see, are very well researched and actually contain references, which we totally welcome. And then we also have collections from mothers and parents. This one is from Heather Withrow, who is both a parent of a son with deafblindness and a deaf artist herself. So she has a really great blog called A Mom's Musings, and she's shared some of her thoughts about communicating with her deafblind child here. So she has really shared a lot of really good videos. She shares this great video of a finger tapping social conversation between her son and her husband. So the next thing I wanted to talk about was guest hosts. So those are the people who create the collections. You can go on the site now and suggest a guest host. It can even be you. We would totally welcome that. You can really gain you get a lot of people looking at your posts, and you can link back to your own blog or your own site or information about what you're doing. Or you can really just share your expertise, and we highly recommend you do so. Okay, so there's also profiles. So everyone, when you go on the site, there are profiles where you can view information about a bio. I have my glamour shot up there. You can also see, it's a little bit small right here, but at the bottom you can view all the posts that I have created, and you can do this for anyone who's posted in the community. Okay. Are there any questions so far about the forum or the collections or anything else I've talked about? Yeah.
It's a language translation. How do they do that? Is there somewhere where they click on something to put it?
Okay, so you were asking about language translation. So At the top of the page, you'll see it says English here, and then you can click and you'll see Spanish, Chinese, Russian, Korean, Vietnamese, Czech, etc. Does that answer your question? And like I said, it doesn't translate the actual posts, but it does translate all the everything else on the site. So we didn't want to do a Google translation, which might not be accurate and might distort meaning from some of the posts. But we do have some posts in Spanish and resources for people in Spanish as well. So, yeah. Does that answer your question? Okay. Any other questions? Okay, so I'm going to talk to you about shared science. So this is the last part. So this is where we view data on, this is where we view data that we collected from the communication matrix assessment, and we include infographics that are really highly accessible format. So basically, an SLP or a teacher would do an assessment on an individual with Dandy-Walker syndrome or CHARGE syndrome, along with hundreds of other SLPs and teachers around the country. And then we receive that anonymized data, and then we can share it with the community. So we create these portraits of communication skills in populations that have been assessed by the matrix. And we have a focus on rare disorders right now, where you may not have seen or worked with a child or individual with Dandy-Walker syndrome, and now you can learn more. And it's a really great resource for parents as well. They can, if they just got a diagnosis, they can look at, oh, here's what communication looks like in the early stages of communication for an individual with this disorder or disability. So I'm going to click on the data here. We're going to look at Dandy-Walker syndrome today. And it will just start with some demographics and about the sample that we chose. We usually do 0 to 22 years old and within the United States. And we show you where we're getting that sample, the ages and gender. And then we have functional impairment charts. So people will answer these questions at the beginning of the matrix about hearing impairments, learning disability, other impairments, physical impairments. You can see there are 48% in our sample of individuals with Dandy-Walker syndrome that have physical impairments. So you can really get a sense of other individuals with this disorder. Was there a question? Okay, just movement. Okay, and then the really exciting part here is the big picture, which shows composite data based on the entire sample. And if you know the matrix, this is the profile you get at the end. But if you don't, it's pretty, you can see where we're coming from here. So the darker orange colors are higher people who've mastered skills in that cell, or that level. So this shows the percent of each sample for whom the highest score in each cell was mastered. And then you can also look at mastered or emerging, and you see more skills there. And then you can get very in-depth and look at the behaviors used for intentional communication and the percentages for each one of those. So we could look at concrete symbols, and we can see that in individuals with Dandy-Walker syndrome in our sample, 16% have mastered using concrete symbols to refuse and reject. Okay, and this is really revolutionary. Again, like Emily was saying before about having the advantage to come to conferences like this is really great. But not everyone has that, and especially parents are not going to be going to a conference like this and getting information. And so they can access this really potent information that's not behind a journal paywall and it's not behind a password protected site. It's really available to everybody. So if any questions about shared science? Okay, so I'm going to move it back to Emily, and she's going to talk about what's happening in the community right now.
Thank you, Alex. I think Alex did a really great job of trying to really quickly show you about all of the key features of our website. And I just wanted to highlight that, again, all of these features exist in this open setting so that professionals across disciplines can share information, and that information, especially related to, that rare disorders piece that she talked about in shared science, can sort of fill that gap that exists about serving children with complex communication needs. So again, our major goal is to support the education of children with complex communication needs. And when we look at who's a member and who is supporting these students and individuals, we see that the vast majority are SLPs. We have around 3,200 SLPs that are actively participating in our community. And we've got about 1,600 educators, as well as almost 300 parents, which is really exciting to see that there's a space online where teachers, educators, and parents can be having conversations about students. That is very exciting to me. As well as there's quite a few OTs, and there's almost over 80 OTs, around 20 PTs, over 100 researchers, and then there are some other groups that have sort of been condensed into this other category. So while the majority are still SLPs, we see that there are multiple members that are participating and contributing to this online space. And I think that that's very important given how necessary interprofessional collaboration is for students with complex communication needs, and I think overall in allied health or educational services. It's really important that we're working together and not just sharing information specific to speech language pathologists. And so I think that's really important. When looking at who's writing posts and comments, we see that even though SLPs are the vast majority of the site, actually educators are both commenting and posting at a higher rate. And so I wonder in part if that's because they don't have an outlet like how we do have the ASHA community to participate and to contribute and to ask questions. So that to me is great that educators who already report by themselves that they don't feel supported have a place where they can ask and answer questions, as well as the fact that there's still a quite significant amount of SLPs that are contributing to this community as well. So SLPs are using their broad resources to be a part of multiple communities online. And I think that's really great for our profession because, again, it takes us outside of just being here at ASHA or just being in the clinic room. We're allowing ourselves to advocate for what we do as speech language pathologists in multiple settings. And I think having researchers pay attention to our concerns as being part of this community, as well as parents understand the kinds of questions that we ourselves have as professionals. I think that makes them more open to being able to ask and potentially answer questions on the community. And I think that it's really, really powerful to see that even though there's some educators are communicating and participating more, it's still, there's a variety of members who are contributing to this dialogue online. Another really great thing that we see that suggests that our community is really healthy is that we see that our new visitors and returning visitors are both hovering around 50%. So about 50% of our users are returning, or I'm sorry, about 45% of our users are ones that come back to the site, which is great because that lets us know that they found something that they really like and they are continuing to contribute or they are continuing to read information, as well as we're seeing that just over 50%, 54% are new users, which is great. That's suggesting that it's bringing in more people. If we only saw returning users or users, that would suggest to you that there maybe isn't the right amount of information on this community because people weren't sustaining their participation and it wasn't attracting new people. Or it was only attracting new people because people wouldn't stay around. They didn't find things that was valuable to them. So this is actually really, really encouraging to us. And we also see the trend in the number of visitors in our community since it launched in 2015 to 2016 just steadily increasing. So again, you might visit today and find information that's helpful to you, but if you come back 3 months from now, 3 weeks from now, there's going to be more and more information. And so the more that people visit and contribute, the stronger this community is going to be, like any social network. And so Alex is going to talk a little bit about the activity of our research team.
Okay, so in creating and building communities of practice, it takes time. In any COP, the creators are going to play a big role in content creation initially. And in these charts, you'll see the yellow indicates community members, and then the, I guess it looks peach up here, or orange, is the Matrix team. And so that's the few of us who helped create the Matrix site and are helping facilitate team members, which I'll show you later. And as you can see, the creator's role has gradually decreased as time goes on and organic users start creating most of the content on their own. There's a really great article by Nielsen in 2006 where he talks about the 99-1 rule, where 90% of the users are just lurking and they're just viewing the material. They are still getting benefit from looking at the site. They are still reading and can still use those things. They're just not creating posts themselves. But they're still a valuable part of our community. And then there's the 9% who post occasionally and 1% who post very often. And we've really found that to be true as well. And I guess as you'll see in this chart, that by year 3, which is this year, so it's not the entire 12 months like the other two, but you'll see the Matrix team has gone below 30%, and the vast majority are community members who are posting. So part of what we did with this project is, like I explained before, we made this community free and open to everybody right at the start of it. We decided not to do, while we do have sites across the country, we decided we didn't want to just start just with them and expand. We decided we want to just have it open from the beginning, and we will adapt and change based on the data we collect from these small sites. So we have many sites around the country. I'll show you the map in a slide or two. The participants will use the Matrix to assess a child, and then they will beta test the online community. The participants are teachers and speech-language pathologists, family members, and then the students are 0 to 21-year-olds who use less than 3 words meaningfully together. And using less than 3 words meaningfully together is basically saying they are covered by the Communication Matrix assessment. We are going to be recruiting more sites in the coming years. And in these development sites, we tried to also include the administrators, the assistive technology specialists, and the paraprofessionals in the study process. So here are the development sites. As you can see, they're all around the country in very different kinds of areas. We have some very rural places that we're looking at in Oregon, in the high desert area, and then we also have, ones right outside of DC in a very high need area. And we have some in Texas and Oklahoma and Chicago, all around the country. So we really tried to get a vast sample here, very different places. And what we're doing at these sites, we have on-site training from facilitators that they already know or have fostered some kind of relationship with. They use the Communication Matrix suite, which includes the webinar that Emily talked about earlier, as well as assessing the student. The community of practice participation, so we encourage them to go online. Often we have prompts for them to write something or comment on the site. And then we have development site virtual meetings, as you'll see there, and Communication Matrix shares, where we look at a matrix of one of the children, assess, and we talk about it with the team that created that matrix. And I'm just showing you, this is really how we started, and our goal is to have less and less involvement in the actual intervention, so that people don't actually need us and don't actually need the on-site training. We would love to not be needed. But we really want it to just be something that you can go to on the site and find an intervention and improve your goals, your IEP goals that you are creating for your student. So already, we're not doing matrix shares. We've encouraged that kind of participation to go to the community of practice and just ask questions via doing posts. So we have a few thoughts to share in my last couple minutes. I'll just point out a few, but basically people are really liking, in the middle you'll see, I love a focus on complex communication needs. Frequently I look at sites or information that does not apply to my students, and it's great to have a site that focuses on students I work with. And so that's really great to hear, because that was the whole goal of this, is to have a space where people who work with complex communication needs can go. A lot of these are all positive things, but some of the negative things we're seeing is about the time factor. And that is something that we're thinking about a lot and trying to make it easier and easier to access. Also, quickly, I can point out a few, some preliminary data. 83% of users say they occasionally or often find something useful in the community. And then we asked them a couple of questions on a scale of 1 to 5. You'll see signing up and liking, getting the email updates hovered around 3.8 and 3.9. And then 4.3 and 4.2 are using the community will help me better serve my students with complex communication needs, and I would recommend this. And what we really see there is there may be some technological hurdles to accessing the site, but once they get in there, they really find it useful and they recommend it to their other professionals. We've already responded to the feedback that we've gotten and improved it even more and made it easier to access. We integrated the assessment in the community. It's mobile ready, like she said, and we've improved the collections to be more topic-based. Yes, back to Emily.
Okay, so in summary, communities of practice, they spread ideas. We've already talked about how professionals have limited access to training and resources to support individuals with complex communication needs. The Communication Matrix community is a free way to receive training and support. And our whole goal is to achieve our goals together. So we're trying to improve educational programs for students with complex communication needs. And so I would just encourage you to be a part of our community. You can access that on our website, www.communicationmatrix.org. We have some pamphlets up here at the front that are sort of a one-page summary of just what the Communication Matrix assessment is and what the community is. You can email us and follow us on other larger social media platforms on our Facebook and Twitter. And we do have a few minutes left, just about 2 minutes to take questions for people who have. Yes?
Do you have any issues around vetting posts or quality of posts or anything like that?
Yeah, so the question was, is there any issues around the quality or vetting of posts? And so at this point, we haven't had issues around that. And there are a couple ways that we tried to address this. So one is which before you post, we didn't have time to sort of go in the whole composition of how posts are created because it's a 1 hour talk. But as you're posting, there's a place that says, I have the release to be able to share this kind of information. So that's one step. There's another place where you can report people on the community who are abusing the community. And then there's another way that we've built that in because the posts that are liked the most will kind of rise to the top of your feed, and the ones that are sort of, if you're familiar with like Reddit or other, it's up and down. Yeah. And so those are features that we built in to the, sorry, go ahead.
Oh, I just wanted to add that part of our idea with the collections was that there were experts that had more knowledge on the topic, and that those collections may be more vetted in that way than a post that just appears on the community. And we encourage everyone posting in the community to provide their links and resources. Yeah, so that was our idea. We really wanted an open forum, but we also wanted this piece of here's where you can go to gain information from people who are well known in the field. And that's right. You could create an anonymous profile if you wanted to, but most people we haven't seen do that. Yeah. But yeah, like you saw my profile, you don't have to have a picture. You don't have, if you want a picture, you don't have to have your face. It can be anonymized if you want it to be, but yeah, people don't seem to care that much anymore. So yeah. Any other questions?
Maybe one more question.
Sure.
It's wonderful. What's your funding model? It's so wonderful that it's free for users, but how
Do you want me to answer?
Sure. Yeah, that's a great question. We've been thinking a lot about that. We actually just,
I'll pull it up.
yeah, we just put out a donation campaign for the holiday season. So we do accept donations. Yeah, you can see that. So that's a new thing that we're starting to get more and more of. Also, there are parts of the assessment side of it that we charge for. We charge for the webinar. We charge for a individualized report that you create with recommendations of IEP goals. We didn't get to talk about that, but we do charge for that. There is, we've thought about putting ads on the site that would be very targeted. So they would be things like AbleNet or, you know, a lot of the vendors you see here, but it wouldn't be things that we wouldn't vet. Like it wouldn't be the Google ads saying, you know, get them now or whatever. So
Yes.
we really don't want that.
No, and we've built in a 403B, right? 403C.
Oh, yeah.
So we have we've really been thinking about sustainability because at a certain point, the U.S. Department of Education is no longer going to give us grant funding to do this, but we are not going to be among the sites that just stop appearing because the people have done over 700, no, how many?
Oh, assessments?
Yeah.
100,000.
Over
yeah.
100,000 assessments. So this is a tool that's used quite frequently by especially individuals for individuals that there really are not other assessment means that are readily available. Like the communication matrix for this population. So we realize this isn't something that we ever want to go away. So we are very seriously pursuing. We have a marketing team that's working with us to try to figure that out, and that's all. It's all part of our strategic plan. So we are thinking about this, but we do very much want to keep the communication matrix assessment free, so that people will not have to pay for that. But so we're thinking about that, and then potentially approaching some other maybe publishers or other groups who have started to go into looking at online content, like Pearson or Paul Books Publishing, and some folks like that we've been back and forth having conversations with. So, yeah. What other questions? Any? If you do, we're over time now, just by 2 minutes. So if you want to come up and talk to us in person, we'd be happy to answer your questions. Thank you so much for coming.
Thank
Join the
you.
community.
Yeah, if you want to go home with more of these, please come and get some also.